carefully. A diverse group of child welfare advocates is urging the Tasmanian Health Minister to immediately restart new parenting groups. They're so concerned a letter has been sent directly to Michelle O'Byrne. 20 people have signed it, including a paediatrician and a psychologist. The state government denies scrapping any groups, but admits some are on hold as it looks at new financially sustainable options. Either way, as Fiona Breen found out, there are some very unhappy new parents.
Motherhood has brought Launceston women Amberlika Trevika and Imogen Brown together, but it wasn't until their babies were already a few months old. Both had hoped to be part of the new mums groups, which they'd heard so much about.
I was really looking forward to becoming a member of one of the Hey Mums groups, which would have been really good for me socially, and I found out about that through the child health clinics and just got in touch with the Hey Mums group. So yes, it was pretty disappointing when I found out that it wasn't going ahead, because that was my avenue to starting some networking and getting to know other new mums.
All newborns are referred to child health nurses for checkups at about 2 weeks of age. Mothers' groups are normally set up and run by the nurse soon after.
I was disappointed when I found out the program was not running or on hold.
Under a new system within the Child and Health Parent Service, there are fears the groups have been scrapped.
I think early on is a good time to be able to join these groups, such as the Hey Mums group, to be able to start the support networks with other mums, and especially with mums that have babies the same age as your baby.
Paediatrician Dr Ian Stewart is so concerned he's signed his name to the letter sent to the Minister.
I think we're all aware of the vulnerability of new mothers to postnatal depression. I think I see an enormous amount of anxiety from first-time mothers who are unsure of the steps they should take and the remedies that they should apply. And I think these are really simple avenues to try and allay those concerns at an early point before you're actually picking up the pieces later on.
He's worried about the flow-on effects, which he says could be detrimental to the health of the baby and mother.
I think the vulnerable points of this relate particularly to the success of breastfeeding. I think they relate to the mental health and mental status of families, particularly young mothers, and with those sensitivities it obviously relates to the well-being of the child in the context of that family.
Mothers' groups are not the only victims of budget pressure in the child and parenting service. The Australian Nursing Federation has been told vision and hearing checks for children in the prep year of school have also been cut. There are also concerns about staffing levels.
I'm concerned that with recent people leaving Child Health and Parenting Service and contracts ending, that so far they haven't been renewed, and so far at this stage the nurses are so busy doing their other work. We don't know whether they'll be resuming or not. Sometimes you lose these things and the chance of getting them back becomes slimmer as time goes on.
The Australian Nursing Federation agrees. It says the loss of mothers' groups is the tip of the iceberg. The Child Health and Parenting Service is being hit by budget cuts.
It's the one-on-one appointments, the assessments, the ongoing care of the new babies and new families that is really important. And even that critical service now is being cancelled due to the lack of staff and the budget cuts. So despite management saying there are no budget cuts, it's very clear that we have around 5 vacancies just in the south. We also now know that there's about 3.7 FTE not being replaced. That's about 40 appointments now on a daily basis that are being cancelled or postponed. And that's just not good enough for a service that's so vital for our future.
The state government says while there have been restrictions on temporary and casual vacancies, permanent positions are being filled. But a survey of child health nurses has revealed staff under pressure.
Our family child health nurses are very concerned, morale is low, sick leave's not being replaced, appointments are being cancelled, and they can see the whole service being disintegrating.
Good girl.
ABC staffer Kayla Lampard is a new mum who feels like she's missing out on support.
The first time the health nurse came to our house, she sort of said, yeah, mothers groups are great. You know, you'll get a lot of support. You get to chat to mums Zoe's age, with baby Zoe's age. And it wasn't until we got to her 4-week appointment at the actual centre that they said, we don't have enough funding for mothers groups. We sort of have had to choose, and they've slipped.
It was something she'd been looking forward to.
I actually was chatting to my husband about it, and I did get a bit teary because I've been just wanting to seek out parents to talk to.
The Child Health Association is trying to help, but it's finding it almost impossible.
We'll run some coffee mornings for mums, but we don't feel that as a volunteer organisation it's a challenge for us to have the capacity to do it, but it's also a challenge because we can't pretend that we have the expertise that they're going to miss out on.
The state government says mothers groups have not been scrapped. They're on hold or in transition to a new, more financially sustainable model.
The government can put as much spin as they want to put on this issue, and they can say there are no budget cuts, they can say there's no changes, but there are. And therefore people are not getting the service and the access that they should and rightly should be able to be entitled to.
Kayla Lampard's clinic organised a one-off morning tea. They'll have to organise any future get-togethers themselves.
I'm still trying to use other internet means to seek out mums because I still want to catch up with people. I need to chat.
In the meantime, these new mums are doing the hard yards themselves.
We're missing out on the professional advice, and obviously we can do all our own research and I think you have to certainly be very proactive in finding out all this information, but I think having that support network would be a lot less stressful, and I think especially for our mental health, just having that network of friends and professional help.